as we get better at printing, we can begin to focus on the real point of this particular experiment, and that is the metrology that makes it possible to monitor quality. So here we're printing with two different API levels. And so what we want to be able to measure is, look, is there the right dose inside of this drug? And the tool that we're using to do that is NIR infrared spectroscopy. And our first experiments are pretty exciting. So you can begin to see, as Keith will explain, what those differences are and how we see them.
Sure. So here we have two different prints, multiple prints for each formulation. And as was mentioned, this one is a lower API, a lower amount of active ingredient, 20%, while these are 41.7%. And so we want to see those chemical differences in the near infrared spectra. And if you look here, you can see this peak is associated with that active ingredient. And if I bring that up, you can see there's a large absorption of that active ingredient at this wavelength. And you can see the relative difference of this peak compared to the excipients in the higher dosage than in the lower dosage. So in the higher dosage spectra, the peak is higher relative to the excipients peaks. In the high percentage prints, and in the low percentage prints, the peak is lower compared to the excipients. And you can actually accentuate those differences using some math treatments like the second derivative. This math treatment actually inverts the peaks, but it acts as kind of like a baseline correction and gives you better reproducibility because it removes the baseline differences that could be associated to things like porosity or density. Right here we're just interested in the API content. So you can see these multiple measurements and even different tablets really kind of overlap nicely for the low formulation and the high dose formulation.
So really what you're seeing here is a pretty important difference. That is, we can reproducibly, even in our early printing, see a clear difference in API concentration. So is this the right amount of active ingredient in the 3D printed drug? Can you tell with spectroscopy? Wow, you sure can.